We've got about 9 minutes before 8 o'clock. We'll have CBS News at 8, followed by a look at local and area news. Passavant Hospital is the home for the Center for Pain Management, and joining me by telephone is the director in CRNA, Randy Moore. Randy, first of all, thank you very much for joining us this morning. We appreciate it.
Thank you, Gary. It's a pleasure to be here.
When we talk about pain management, are we talking with medications? Are we talking with rehab, physical therapy? How do you address it?
So what we have created here at the Center for Pain Management at Passavant is a comprehensive pain clinic service. So that means that we provide all facets of pain management therapy, anywhere from medical management for patients who have pain that's not amenable to interventional treatment to complex interventional treatment. So we do injections. We also do medical management with a variety of different medications. Also, we have a robust ancillary service line. So we refer patients to rehab, to dietary, to psychiatry. So we really provide a very thorough and comprehensive pain service.
And the pain you deal with, is it chronic pain necessarily?
Most of our patients that we see are patients who suffer from chronic pain. Having said that, we do on occasion see patients who have acute pain related to injury. The good news is we take all comers, and we develop a plan with the patient. The providers develop a plan on how to best treat their pain symptoms.
Now, pain's not fun, obviously, but it is a way of the body telling you something, correct?
That's correct. So if you're experiencing pain for any period of time, that's not okay. And what we say is if you have pain that's beginning to interfere with the quality of your life, then there's a pretty good chance that we can help you.
Is it a relatively new field dealing with pain management?
We've had for instance, our pain practitioner here is a board-certified anesthesiologist who's been practicing pain medicine for over 18 years. It is an evolving field, and we have new therapies and treatment modalities that are developing as we speak. So it's a burgeoning field within anesthesia and pain service.
And when you talk about pain management, you're not talking about masking the pain sensation, are you?
Well, the goal is to get your pain under control. And there's a variety of ways we can do it, and then address the underlying causes of your pain. And there's a variety of ways of doing that as well. So it's twofold, both to control your pain and then to identify the cause and to treat it effectively and permanently.
And as you've indicated, pain not necessarily is a bad thing in that it does tell you that something is wrong with your body.
That's exactly right, Gary. So if you're experiencing pain for any length of time, you need to listen to what your body's telling you and seek medical evaluation.
Typically, what happens when you walk into the center? You've got, let's say it's a back injury, a lower back injury. I'm sure you get plenty of those.
Oh, yeah.
What kind of steps are you going to go through? Give us an idea of what somebody may find out, may go through on a typical first appointment.
Sure. So what happens is you're referred to our pain clinic from your primary care provider. We get all of the information from your primary care provider, including any diagnostic or radiologic tests that have already been done. You'll meet with a nurse, and then you'll meet with one of our pain practitioners. And he or she will discuss your pain in great depth and develop a treatment plan with you in collaboration with you. And so that may involve additional testing, it may involve medication, it may involve injections. What we do is develop a collaborative decision on how to best treat your pain.
And that's an ever-evolving plan, is it not?
That's correct. So what may we may try something that does not work, and we decide to do something else, or we may find that what we're doing is working just fine, and we'll continue that therapy until your pain is resolved.
Well, and then there's some people out there might be listening and saying, well, okay, wait a minute, medication, that means I got to take pills, that means, am I going to become reliant upon these pills, either being addictive to them physically or, psychologically? Yeah,
that's a common concern that we see with our patients. And what we do is we develop an individualized plan. So, narcotics can be a part of that plan, but there's also non-narcotic treatment as well. The good news is that you'll be working with an expert pain practitioner, and they are aware of the benefits and risks of narcotics. And narcotics used specifically to treat pain in a limited time frame are effective, and the risk for addiction is very low.
I am a patient of the center, so I know from what I speak. One of the questions that I have the most difficulty answering, honestly, is that one that says, what's your pain level today?
Right. Yeah.
I know,
yeah,
because right now it may be at 2. Now, about 2 hours from now, it may be a 5.5. I don't know.
Right, and that's the complex nature of chronic pain. And that's why, really it's advantageous to have someone who understands that, working with you to take care of your issues.
Is the end result always going to be that we're going to be pain-free?
Unfortunately, we can't guarantee you that. But what we do guarantee you is that we'll do everything we can to keep it as controllable as possible. The key is for you to take over, to get control of your life again so you can live a happy and healthy life. Whereas, we can't guarantee that you'll be pain-free, but we have the latest state-of-art treatments, and we'll do the best that we can to give you a quality of life that you deserve.
And is one of your efforts to try to stay away from surgery as much as possible, or is sometimes that the best option?
And sometimes that is the best option. Sometimes we'll try what's considered conservative therapy, whether it's injections or medications, and we determine, the best thing for you is to have surgery. But we don't rush into those kinds of decisions, and you're involved, obviously, in that decision-making. And if we determine that you need to be evaluated by a surgeon, then we'll facilitate that process.
Must you always be referred to the center by a doctor?
So we have created a process where we ask that you just have your primary care provider referred to the pain clinic. And the reason why we do that is because we know that your primary provider frequently has already evaluated you, and they've tried things that may work or may have not worked. And there's also ordered diagnostic tests like X-rays, CAT scans, and MRIs. So we prefer to use your primary care provider as the referral.
Randy Moore is a CRNA and director of the Center for Pain Management at Passavant Hospital. You've been hearing about it in the commercials. Now you got a better idea as to what the center does. Randy, I appreciate your time this morning. Thank you very much.
Thank you. It's a pleasure.
Take care.
Okay, bye-bye.
Bye. Center for Pain Management out at Passavant Hospital. And yeah, I have used it, and in fact am using it now, dealing with some lower back issues, but seem to be getting much better. Maybe tipping my hand. I'm supposed to go back to the doctor on October 1st. Wait a minute. Maybe I just took care of that by admitting that on the air. And I don't have to go back. Probably not. All right, we've got about minute 15 before we join CBS News at the top of the hour. Then we'll follow that with a look at local and area news. Things to not do when you're doing the iPad. I'm doing sports, and I hit a button, and about half my screen goes to bookmarks. And the script that I was reading went from very readable to just barely readable. You got to be careful where your finger hits and what it happens to hit, because sometimes it may not hit the absolute right thing. Well, thanks for joining us on this Tuesday morning, last day of summer. Go out and sunbathe, swim in the pool. Probably both would be rather cool to do today. Or if you're like us, then maybe shutting down the pool, maybe in the offing. Fall begins tomorrow morning. I swear, at times in the past, it's been the 21st. It's been the 22nd. I don't ever remember it being at this late. But it is. Early tomorrow morning, by the time we talk here tomorrow morning, it will be fall, officially, even though it really began September 1st for most of us. All right, we've got a break for CBS News. Follow with a look at local and area news. WLDS Jacksonville. Our time at the tone is 8 o'clock.